It was really inspiring faces and words to set the scene for this event. It's now my honor to invite you to listen to our first speaker, who unfortunately cannot be with us in person, the director of UNESCO, Miss Audrey Azoulay, who has prepared a video statement for the occasion.
The COVID-19 pandemic is a stark reminder that access to reliable, high-quality information is vital and something that we need to defend today more than ever. This is what UNESCO does, especially through media and information literacy. But this is also what the World Health Organization does, working tirelessly at our side to ensure that the health crisis does not become an information crisis. Young people are essential to this process, and this is why on International Youth Day, UNESCO and the WHO are paying tribute to young people, youth organizations, and youth networks. During this period, you have played a key role, and you're still playing it, in fighting for the truth, especially on social media, where the stakes are so high. Through your efforts, you're helping us shape the world to come. Thank you very much, and bravo.
Thank you very much. I'm certain we can speak on behalf of, I can speak on behalf of my colleagues in saying how delighted WHO is in the collaboration with UNESCO. We look forward to continuing to work together to support young people. Now I would like to invite WHO Director General, Dr. Tedros, to speak.
Thank you, Sylvie. Esteemed colleagues and friends, the theme of International Youth Day this year is Youth Engagement for Global Action. Today, I would like to join Ms. Audrey Azoulay, UNESCO's Director General, as we recognize young people, youth organizations, and youth networks around the world for their collective action during COVID-19. Thank you for your continued support and your energy, creativity, and motivation to get us all through this pandemic safely. You have a big role to play here. This pandemic is having a major impact on the future of young adults, not just from the virus itself, but because of its impacts on the economy, employment, education, and the overall health system. Despite the challenging circumstances, my colleagues in WHO and I are inspired by your resilience and by your commitment to contribute to the COVID-19 response in your local communities and beyond. We want young people to be informed and make choices about their health to prepare for long and healthy lives. It's critical that we engage with young people now to start the journey to understanding their own health. At WHO, we're working with young people so that we can better understand their needs and concerns as we develop our guidance for COVID-19 and other health issues. Although most young people are not at high risk of severe disease during this pandemic, they play an important role and share in the collective responsibility to help us stop transmission. We would like to help prepare young people for their important roles in the future as health emergencies and disease outbreaks may become even more common. Young health professionals and students are on the front lines of this pandemic in hospitals, health centers, and testing clinics. Many young people are essential workers or volunteering to support their communities, delivering food and medicine to the vulnerable. Others have supported advocacy and risk communication initiatives, such as community radio to combat misinformation, an online hand-washing challenge, and translating and disseminating public health information. Other efforts include developing apps to collate COVID-19 guidance from reputable sources and running surveys to gather behavioral insights to better inform public health response strategies. I will leave you with three requests. First, I would like to call on organizations, institutions, and governments to listen, engage, and empower young adults as partners in action. Our future is their future. Second, we have to give young people a much larger role in political decision making. Their voices often go unheard, even though more than half of the world's population is under 35 years old. The engagement of young people is essential as we confront the health challenges of today and the future. Finally, and most importantly, to young adults around the world, I say, think big and be bold. We count on you for your creativity and your fresh ideas. Your voice and engagement are needed more than ever, particularly as the world responds to this unprecedented crisis. Working together, all of us, old and young, from everywhere in the world, can overcome this pandemic. I thank you.
Thank you very much, Dr. Tedros, for those inspiring words. We have now 3 questions that have been sent in advance by young people. And we would like to direct this question to you in hope that you will be able to provide your thoughts for all the young people listening. The first question is, young people have often been blamed in the media for driving the spread of COVID-19. Is the media exaggerating, or is it true that young people are responsible for the increasing numbers?
You know, I have spoken, the DG of UNESCO has spoken, and we have many good experts here, my colleagues. So why not they get the chance first, and then if there is anything I need to say, I will say after them. So that would help because then the world can see also that I have a very good team. No, you can give her a round.
Thank you, Dr. Tedros, for the opportunity to answer this question, although I'm certain that the young people listening would certainly like to hear from you as well. I think with regards to the question that has been posed, in essence, no, young people themselves are not responsible for the increasing numbers of COVID-19 cases. However, we do know that sometimes uninformed decisions can result in risky behavior that might increase the spread of COVID-19. There are many situations and activities that we know of that can increase the risk of COVID-19 transmission. We know large gatherings where physical distancing cannot be maintained, such as music festivals, or one such example. Also, poorly ventilated places where there is physical activity, like gyms and nightclubs. But we must remember, I think, that these situations and activities are not confined to young people only. It is the responsibility of each person, both young and old, to understand the risks that are posed by these situations and scenarios, and to be able to take personal decisions accordingly. And I think that would be what I would answer to that. And I don't know if you'd want to add anything, Dr. Tedros.
Thank you very much, Sarah. And Dr. Tedros, do you want to add anything on this question, or can we can move to the second question? So, and I agree, it's very important to empower young people to make informed decisions and to dispel some of the unnecessary blame. So the second question was more looking at the future. And Dr. Tedros, do you have any idea of and what is your vision for young people as the world enters a new normal? What are the roles and responsibility of each of us regarding this new normal?
Okay, I would have loved again for my colleagues to continue to participate, but I will be happy to take this one, and then I hope they will be involved on the other issues. Because when just one person only speaks, it could be boring. That's why I wanted to. So on the vision, I mean, this pandemic is very unprecedented, and um, you know, for the future, we need to think big. Um, my vision for the youth is for our world. I think we have to build it back, greener, healthier, safer, and fairer, equitable one. And we have seen the root cause of the problems, as you know. It's the COVID has been actually now helping many countries to see what the root cause of their problems are, the inequity in their society. So I think the four issues I raised, I know will be something that many of you would also go for as a vision for our planet to address the root cause of our problems. And then on your role of the young people, you have really a critical role to play in this pandemic as we adapt to living in a changing world. And more than ever before, young people have access to information and digital tools, the ability to create networks and to influence others. But vast inequities exist, and in many parts of the world, we're living in a culture of blame and individualism. And the good can be in this good. This could be in the form of the roles that you can play, advocacy for the inclusion of young people in both decision making and in the implementation of efforts to recover from COVID-19 and to build resilience for future events, and standing up against the culture of blame, stigma, and discrimination, and thereby setting an example for all people everywhere. And last but not least, I want to see young people using their voices to promote equity, collaboration, and solidarity. And as I said earlier, I will end with those. Uh, I know what you want, and our vision, the vision for our world is to have a greener, healthier, safer, and fairer, equitable world. And you have a big, big part to play to make this happen by doing what I said, but even you can do more, and we count on you.
Thank you very much, Dr. Tedros, for sharing this inspiring vision for better world, greener, safer, fairer, and healthier. And by the way, it's never boring to listen to you. So we are, on the contrary, very happy to have you with us today because your wisdom and your experience are really important for everybody on Earth. So really, thank you so much for being with us. We have a last question. So if possible, if we can take a little bit more of your time, we would be very happy if you could share with us a personal story from when you were a young person. And what was there a significant moment or experience that directed you to the path that eventually led you to become a DG?
Yeah, never planned to be a DG. I didn't know that I would be a DG. And even until 3 years ago, because when I started the campaign to be a DG, I was not working that hard, and people were saying to me, "You are a reluctant candidate." So was never in my plan, and it just happened. Sometimes things happen. I always wanted to serve my country because I felt like, okay, my country needs more support than anyone, and anything I can contribute should be to my country. But probably after serving almost 30 years in my country, probably it was time to move on. So the first thing I would like to say is this was never my plan or what I dreamed for. But I am sure about one thing. From early years, I work very hard on the present. for me, what matters is what I can do now to make a contribution, how little it could be, but to make that contribution to the best I can. And I know when we do our best today, it can take us to places which could be okay or something more than we expected or whatever. By saying this, I'm not saying we don't need to have a plan. We can have a plan. But more than the plan, what we do today is really important. And then if I share with you some of my stories, I come actually from a poor family, and my brother died when I was 7, younger brother, which I now gather that it could be because of measles. Uh, I think I didn't accept that situation then, the death of my brother. Even now, I don't accept it um, because it's unacceptable, especially now with the world really having more technology. It's we always say no one should die because they're poor. Probably that I think influenced me in a big way. But I had also some acquaintance with WHO when I was young, almost around that age when during the measles eradication, and when I saw a WHO logo, I mean smallpox eradication logo, and that's another probably that I remember of WHO from early age. And then 2 countries influenced me after I started working. The first one is Denmark, when I visited and saw universal health coverage in action. And I said, UHC is possible. That health for all is possible. And not only that, immediately after that, I had a chance also to visit United Kingdom, and I saw how the NHS operates. And of course, again, I studied also the Swedish model. And I think that strengthened my belief that, universal health coverage, health for all, is possible, that it's an investment. And now even with COVID-19, we can see the centrality of health and why universal health coverage and health for all is very important. But that influence be it from Denmark or other places, helped me to work hard in Ethiopia to make sure that our health system becomes better. And I had a chance to be a minister for almost 8 years, and I had the opportunity to contribute in whatever way I could with the excellent team I had and with the excellent leadership there was. Briefly, that's my life story. Of course, now as DG of WHO, which I said I have never thought of, but one thing you can be sure is whether you're from a poor family or rich family, you can be somewhere. What's important is to really work hard and really have a belief to serve humanity in the best way you can. I think anything I believe is possible, whatever your background. And I know during this COVID situation, many young ones have many mental health problems because of the challenges we see. And this is when a time for you when you need to be really calm and also keep in touch with your friends, with your people, and believe that anything is possible, this thing will change, and that you could be someone to contribute to the world the best way you can. But the first thing is you have to take care of yourself, and then take care of the rest of the world, because you have responsibility. Thank you so much.
Thank you so much, Dr. Tedros, for sharing your personal story. And definitely we'll remember to focus on the present and on the action that we can do today. And today it's International Youth Day, and it's your day. We still have a very nice program ahead to celebrate this day. I'm aware, Dr. Tedros, that your schedule is very busy and you may need to leave. We'll be very happy if you can stay with us a little bit longer, but if it's not possible, we'd like to thank you for your time, your words of vision, your advice, and all the support you have already provided to young people, and all the commitment you show for a younger generation. Thank you so much.
Thank you.
Now, building on the words spoken by Dr. Tedros, I would like to speak about the important role of young people in infodemic management during this pandemic. Epidemics are disruptive, and epidemics are accompanied by infodemic. Infodemic fuel disruption and disease. Young people, through actively combating infodemics, can reduce disease burden. I'm going to unpack this in a few minutes to describe what I mean. If we look back to the 14th century and the origin of the world disease, we find that it literally means a lack of ills, which can also understood as a trouble, discomfort, distress. While the word disease has evolved to refer to a specific illness, the original meaning still holds true. We know, and we have witnessed over the past 8 months, that disease outbreaks, epidemics, and pandemics results in individual level, community level, national level, and sometimes global level, as it is the case for COVID-19, discomfort, trouble, and distress. In addition to the illness caused by COVID-19, the uncertainty, fear, socioeconomic impacts, physical distancing measures, suspicion, and blame are all contributing towards a breakdown in social cohesion, trust, and solidarity. So I also need to talk about infodemic. For those who are unfamiliar with the term, an infodemic is an overwhelming amount of information that spreads rapidly as a virus. This information is good, accurate information, but it can be also false information, fake news, and sensationalized stories that create hype and fear. The infodemic makes it very difficult for people to discern what is accurate and true, and therefore make decisions for themselves and their loved ones about how to protect their health and prevent the spread of COVID-19. It's WHO true belief that young people around the world in diverse situations and contexts have a unique and critical role to play in combating the infodemic and supporting social cohesions, not just among their own peer networks, but across generations and cultures. Why do we believe this? Young people are intimately connected with new and emerging information and communication technologies. Having a virtual and social network was not something new for young people, as it was for many older people who faced situations of self-isolation and quarantine during the pandemic. Young people can use this familiarity with the virtual social world and with communication technologies for good, to take pride in identifying trusted sources of information, to amplify accurate information from these trusted sources, and to speak out against misinformation and disinformation. Also to help others who are less digitally connected, to connect and access these trusted sources of information and to start conversation about issues facing young people and society more broadly, such as mental health, domestic violence, alcohol and drug use, disruptions to education. By talking about this issue and seeking trusted advice and guidance, we expose the issue to a collective scrutiny and enable the co-creation of solutions. This is how young people can build social cohesion, solidarity, and a stronger youth community for the future. Let me give you an example. Imagine you are in a community where young people are struggling to adapt to living under lockdown. They are fearful, bored, and isolated, and many have turned to alcohol as a coping mechanism. The problem is that alcohol use exacerbates existing mental health concerns, affects physical health and learning, affects family life, and more. Perhaps young people do not have access to guidance and support about coping during the pandemic and the dangers of alcohol use. Maybe no one talks about it in a way that is constructive and non-blaming for young people. So young people don't access the help they need. Imagine now that one engaged young person stands up, convenes a group of trusted friends, and start a conversation. They acknowledge that what they are facing, they devise ways to access helpful information, they start an online community to support others locally, they reach out to experienced people, their local initiative gives others the courage and inspiration to do the same. The network grows. Accurate, helpful information and a community around this information is created. It allows young people to face and solve issues together. One person can drive social change. The opportunity is huge, but it can be daunting. I have some advice for you. Think big. Start small, but begin immediately. You may surprise yourself and others. We really count on you. Thank you. I would like now to hand over to Guy Berger, who is the Director for Strategies and Policies in the field of communication and information at UNESCO, who will speak about empowering youth with media and information literacy competencies to resist infodemic of dis and misinformation. Welcome, Guy, and thank you for joining us virtually.
Thank you very much, Dr. Brandt, Dr. Tedros, and all the people on this. So happy Youth Day to you. Now, within the proliferation of content that WHO has called the infodemic, UNESCO has used the word disinfodemic to refer to that part of the whole, which is the toxic combination of fast mutating falsehoods, which can be life-threatening. For us at UNESCO, this disinfodemic within the wider infodemic, the disinfodemic risks drowning out the information strand, the reliable information within the information overload. Disinformation, of course, is not just around COVID-19, it's also about other health issues, and it's about climate change, and it's about elections, and very much more. The problem is that all of these falsehoods can mislead us and even manipulate us. In contrast, each of us, I'm sure, would like to be captain of our own information consumption and to be a skilled producer of truthful information and of opinions that are based on facts and logic. So this is why media and information literacy, MIL for short, this is why MIL is needed to counter the disinfodemic and for much more than COVID-19. MIL is about knowledge. It's about knowing that there is a difference between truth and untruth. But also we need to know that there are some things we can't as yet say are clearly true or false. The science about airborne infections from COVID-19 is not yet finalized, for example. There are indeed proven facts, there are indeed proven falsehoods, and we should know the difference. At the same time, there's also legitimate debate about what facts are the most important and what they mean for actions like the policy actions of our governments. MIL teaches us, media and information literacy teaches us that we have a right to freedom of expression, and this right entitles us to disagree with and debate government policy responses to COVID, for example. This should not be at the expense of facts, but it should be by bringing in values and perspectives about what policies might work best in terms of the trade-offs, in terms of what are the costs and benefits for young people, for example. MIL also teaches us that we have a right to know. This applies to things like getting the full picture of COVID statistics, not just selective or politically motivated numbers. We also have a right to know in detail what the internet companies are doing and are not doing in the fight against disinformation on their platforms. So MIL is about our rights. Our right to health depends on our right to impart and transmit information and our right to receive it as well. Our fundamental rights should never be damaged by steps taken against disinformation. Any such steps need to be in law, proportionate and necessary to the objective of securing public health. When steps go beyond this, they infringe on our basic right to freedom of expression. In summary, we need knowledge and we need skills to deal with truth and falsehoods, with uncertainties and debates, and we need to assert our rights. And that's why we need MIL. How do we get there? Well, when we've got these, we can protect ourselves against disinformation. But how do we get them? It's not just about passive learning to become media and information literate. It's not just about receiving knowledge and skills. It's fundamentally about a dynamic co-creation of competencies through ongoing dialogue. MIL is a process, not a one-way transmission. It's not a vaccine that you can get that will inoculate you against all disinformation for all time. This is why UNESCO refuses to see youth as if young people were simply objects, as empty receptacles who should get a dose of MIL. Instead, for us, young people must be co-leaders and co-creators of MIL in a dynamic way, responding to the changing disinfodemic virus. So what this means is that MIL should not only be for youth, amongst other age groups, MIL should also be of youth and by youth. And this is the rationale of the Youth Committee of the UNESCO-led MIL Alliance. You will shortly hear from a committee member of this alliance. Let us today also celebrate these youth leaders. I like to call them MIL-itants, militants, media and information literacy itants, militants. Recently, we've worked with these activists in over 140 youth organizations, half of which are in Africa, to integrate MIL into youth group activities. This is an institutional approach, which is important because it's sustainable, much more than if we just target individuals, atomized individuals. Together with the youth, we are now at UNESCO preparing guidelines for youth organizations how to integrate MIL into their ongoing activities. The last thing I want to say is that young people are also co-leaders in planning the 2020 edition of what we call Global MIL Week, Global Media and Information Literacy Week, which is the last week of October every year. The theme this year is resisting the disinfodemic, media and information literacy for everyone and by everyone. And building on last year's MIL Week, there will be a global youth hackathon this year to try to explore practical initiatives to come up with solutions that can deal with the disinfodemic, especially in regard to COVID. So this is the invitation that UNESCO is making to young people. Make full use of this global MIL week. It's there for you. You can check the UNESCO website to get the details. You can build your knowledge, your skills, your ideas, and you can get terrific tips on what you can do. You can organize events and you can participate in global events. I will post the link in the chat as soon as I'm finished. So in short, get involved. As Dr. Brand said, immediately think big, start small, but get involved now. Organize activities because the future depends on you. Otherwise, we will all become victims of the disinfodemic. Thank you very much.
Thank you very much, Guy Berger, for these words. We will move to our final speaker for this session, Mrs. Dia Saminarsi, Special Advisor to the Director General, Dr. Tedros, on Youth and Gender. Dr. Saminarsi.
Thank you, Dr. Bria. Um, Good afternoon, evening, morning, youth participants across the globe, esteemed colleagues. I would like to begin with conveying my utmost appreciation to all of you. Thank you for your continued support and your energy, creativity, and motivation during these very trying times. The world has more young people now than ever before. By 2020, it is projected that there will be over 3.5 billion people under the age of 30. Presently, there are 1.8 billion people between the ages of 10 and 24, and 89% of this age demographic lives in low and middle income countries. Youth has a big role to play. We have been discussing the issue for some time now, and it is very encouraging to see that youth voices now emerge stronger and continue to be stronger day by day. Despite global knowledge, preparedness, experience, and resolutions on health emergency, pandemic has put the world at a significantly higher level of difficulties. In the ultimate challenging circumstances, WHO continues to lead in meaningful youth engagement at global, regional, and country levels. Through various dialogues with young people in regional youth and health town halls, we have obtained an understanding of how youth would like to be equal partners and providers of health services as well as change makers in health. Now, with the current challenges of pandemic, we would like to hear and learn from you in how young people can remain being leaders in societies. We believe young people play a very critical and strategic role in turning the tide. You have the strength of youth, innovation, solidarity, resilience, and creativity, which are what the world needs to come out safely from the pandemic. I know for a fact that various youth-led initiatives are going on in many parts of the world as we speak, underlining COVID-19 response and ensuring essential services at primary healthcare level. The spectrum of youth involvement extends between communities to global level and therefore needs to be not only commended, but also be taken up and well documented as youth actions against COVID-19. I would like to end my intervention by inviting all of young people to one, take stock in what and how youth have come together as members of societies, leaders, and experts in your respective fields to tackle the pandemic. Second, whenever possible, be actively engaged in lending your expertise in those initiatives. Or even better, lead and innovate your own innovation. At this trying time, no contribution is too small, and every fresh ideas matters. Third, share the information, best practices, learning experience amongst yourself and other youth networks to expedite systemic change that can turn things around. Finally, to young people everywhere, allow me to echo the Director General and colleagues here in WHO in reaffirming our solid commitment to your efforts. Together, let us collaborate meaningfully, build back our world to be a better place for our lives today and for generations to come. I thank you.
Thank you very much, Dr. Tedros, Ms. Azoulay, Mr. Berger, Ms. Saminarsi, for your time today and thoughtful and encouraging and inspiring words. It's very important to engage young people in global discussion. And for organizations like WHO, UNESCO, and others, institutions and governments, it's also very important to listen and to engage and empower young people as partners in action. As Dr. Tedros said, our future is their future. I would like now to move to the second part of this event, and I hand over to my colleague Sarah Hess, who will moderate the next session. Thanks, Sarah.
Thank you very much, Sylvie, and hello and welcome to everybody again. I'd like to thank the senior leadership from both WHO and UNESCO for the encouraging and sincere words. It is true that the commitment, the resilience, and the creativity of young people are key reasons why their involvement in the COVID-19 pandemic response is critical. It is also true that as international organizations, we have a responsibility to support young people, to provide a platform for their voices to be heard, and to enable and to promote their action. In this second section of the event, I have the significant privilege of introducing some exceptional young people who have come to share with us today stories about how their lives and communities have been impacted by the pandemic and how they have been motivated and inspired to start projects and initiatives. So I would like to say thank you to these young people for being here today, and I would like to move to our first youth representative. This is Dr. Kayleen Matter, who is the Youth Hub representative from the Global Health Worker Network. And Kayleen is in the United States of America, so thank you for joining us so early today. Over to you, Kayleen.
Thank you very much, Sarah, and hello, everybody. It's an absolute pleasure to be here with you today. Just by a quick way of introduction, I'm actually a Lebanese physician who moved here to the United States a few years ago for training. As Sarah very kindly mentioned, I'm here on behalf of the Youth Hub, which is a structure of 800 individual members, but also 35 organizations representing millions of medical students, junior doctors, pharmacists, dentists, nurses, etc. That is based on the WHO. It was founded 3 years ago by somebody named Jim Campbell, who very firmly believed back then, when nobody else would listen, that youth have a significant contribution to bring to global health. So here today, I'm here to tell you their story, not only mine. Very briefly, youth are often portrayed as a recipient of health, recipient of interventions, and are asked to advocate for change. But today, I'm very happy to be surrounded by those change agents in the community. But I would like to tell you the story of youth at the front line of COVID-19. Because I'm very good at following directions, I was told to speak about my own personal story. So I will touch on that very, very briefly. So when the first reports of COVID-19 started coming out from China, then later on Italy, Spain, etc., everybody knew that it was a matter of time before it reaches everyone. I was at the side of the world where we were fortunate to have a little bit more time to prepare. Having said that, I would tell you that nothing really prepares you to that one day when you are told that everybody who's not a clinical staff should go home. Every young doctor, nurse, etc., are going to be expected to be performing clinical work for weeks, days, months, an unknown number of weeks. Literally, that was what my boss at work said. And at the same time, personal protective equipment is in shortage. So we are gonna have to save that for whenever we need it, which was back then and there. So at that time, a lot of thoughts raced in my mind. First of all, this is a significant weight on my shoulder. I am an infectious disease physician, so that you can imagine that this is exactly what every infectious disease physician is trained to one day perform. But still, there was a lot of fear, fear of the unknown. I also had no idea when I will be able to next see my family, who is not in the United States, or if I will ever get to see my family again. There is so much we didn't know about the virus, and part of my task was not only to care for patients, but also to talk to other colleagues about how to protect themselves from the virus. So this is what happened in my mind. Yet every single day I went to work. I worked very hard, coming back exhausted, but it didn't matter. And we got through one of the major parts of this pandemic for us. But as you can tell, this is getting worse again. Other colleagues on the front lines were doing a lot of different interventions in order to protect patients, to keep them out of the hospital, to provide rehabilitation services after COVID-19 infections, or providing community outreach, care at home, at local pharmacies, testing, um, as well as quite a bit of awareness. So a big shout out to all my colleagues in the Youth Hub and healthcare workers around the world. So maybe I'll ask for my next slide, please. I have chosen not to share photos of healthcare workers, but rather those illustrations that were made by healthcare workers themselves, and to tell you a little bit how youth in the health workforce are feeling right now. So in the illustration on the left side, you see this superhero, which is what initially many people saw healthcare workers as. Unfortunately, due to misinformation, we are actually seeing violent attacks, especially on young people who are caring for COVID-19 patients in the communities in many parts of the world. What you see on the right is what the face of every healthcare worker at the end of the day looks like these days. And this is something we have learned to live with, but it certainly is nothing very easy. So I can have my next slide, please. Those are additional illustrations where it really feels sometimes very, very lonely as healthcare workers, where we feel like the weight of the world is on our shoulders. We are really in between COVID-19 and the planet. And certainly, again, I keep repeating myself, but misinformation is not helping at all. So maybe I'll get the next slide, please. This is just an illustration to tell you how, again, how healthcare workers are feeling every single day. All of us have lost patients, very many patients, where we are actually the only people at their bedside whenever they're dying because their families could not be there because of COVID-19. All of us have lost colleagues. Some of us have lost family members. And at the same time, sometimes it is human, but we think, why are we doing all of this when we see people out there who are telling us COVID is not real? They're not taking precautions. They're just thinking that, this will pass, or I will not get sick. I am young, I am healthy, or not necessarily I am young, I am healthy, nothing's going to happen to me. So this is another illustration of a lot of our feelings and emotions on a daily basis. And I know that I speak for a lot of the colleagues out there. Maybe I'll have my next and final slide. So, before last slide, these are photos of healthcare workers who have lost their lives to COVID-19. As of right now, there are numbers quoting 90,000 healthcare workers who have been infected around the world. In reality, we know that this is a gross underestimate. We have no idea how many healthcare workers have lost their lives. We have no idea how many young healthcare workers have lost their lives. And we know that with every single epidemic and pandemic around the world, those of you who know people who contributed to the 2014 Ebola outbreak know very well that young people are always the front line of every epidemic and pandemic. We have no count of how many have been infected. We have no count of how many have died. And we don't know which age group they belong to. And I think that this is something that today I'd like to ask you all to help us advocate for more transparency, for government openness, and for accurate reporting of healthcare workers' infections around the world. Now, WHO has tried very hard to provide tools for counting and reporting, but this is a two-way street. WHO can provide as many tools as they want. If nobody's using them, we will never really know what those numbers really look like. This is, I hope I will leave you with that, and that you'll keep in mind healthcare workers on the front lines who are getting infected, losing their lives, losing their livelihoods, and potentially some of their family members as well. And I'll take my last slide now. I will tell you that the Youth Hub is doing very many projects in relation to COVID, especially looking at education and what COVID-19 has done to education of students and early career professionals. cutting it short, putting them very early on the front lines because they are needed, etc., etc. And that's one amongst the many projects that we are doing. So if you are interested in healthcare workforce issues, please do feel free to join us. These are some of the addresses over there. You can email us and you can fill out the form to join the hub, and I'm certainly be happy to put that in the chat as well. Again, thank you very much for the opportunity to be here. And back to you, Sarah.
Thank you so much, Colleen. It really is with deep respect that we listen to your stories about young people and young health workers who are really in the heart of the COVID-19 response. I'd like to now hand over to our next youth representative, Beatrice Banami. Beatrice is the Youth Ambassador for Latin America and the Caribbean countries as part of the UNESCO-led Media and Information Literacy Alliance, and Beatrice is from Brazil. Beatrice, over to you.
Thank you, Sarah, for the introduction. Hello to you all. I'm Beatrice Banami from Brazil, as Sarah introduced. First, I would like to thank the World Health Organization for inviting me to be here today. It is an honor to speak among such brilliant and influential minds. Hello to Sarah, Daniel, and Lahiru, and whom I have been working with for the past few months. And you can pass on to the next slide, please. I'll first tell you a personal story as was requested, and then I'll detail the campaign I'm here to talk here about today. The first time I caught dengue fever, I was traveling through the Brazilian countryside. I didn't see the mosquito bite me, but I soon felt its effect: high fever, painful headaches, intensive nosebleed, intestinal discomfort. I had not experienced anything like this before. The nearest hospital was over 500 kilometers away, but after suffering for days, I was terrified. I did not think there was another option, and I decided to take a bus. I must have looked as bad as I felt, because a local woman caught my eye and took a seat next to me when I arrived at the bus station. I explained my plight, and to my surprise, she smiled and said she had exactly what I needed. 5 minutes later, she returned with a local drink made from a specific tea leaves and a small dose of a specific painkillers, not aspirin. I couldn't thank her enough. For my surprise, she wasn't a health worker or a physician. She was a young, common citizen that learned those facts from listening to the radio. She pointed to a speaker at the bus station. The radio playing over the speakers was no longer playing music, and instead of commercials, there was an informational broadcast of how to deal with medical issues, such as malaria and dengue. That day I realized how powerful the communication of education can be. It doesn't matter where or how. When good quality information can flow into society, and especially into isolated areas, education is no longer just something taught in schools, but becomes a survival strategy for millions. The Health and Information Literacy Access Alliance is a project run by our group of youth ambassadors from GAPMIL UNESCO. We are committed to break the COVID-19 disinformation cycle in marginalized communities who lack access to credible resources of information as a result of lack of internet connection, different accessibility needs, and or existing socioeconomic inequalities and injustice. My co-youth ambassador, Bushra Badi, and I started the project in February, just as the impact of COVID-19 began to manifest itself aggressively around the world. We coordinated then 10 media and information literacy task forces around the world. These included focusing on marginalized communities such as minority populations in India and Egypt, indigenous people in Canada, and populations in South America who do not speak the official language of their own country. Of these South American populations, the Amazonia region was by far the most challenging one. It was a perfect storm of high infection rates, low-income communities, unemployment, famine, endemic disease, high levels of misinformation, and a mixture of different languages. You can pass on the next slide, please. With local stakeholders, we created a package of items we could provide at short notice that would make the highest impact. With the University of Amazonas, HBO, and UNESCO, we then created a successful crowdfunding campaign to sponsor this work. In a short period of time, we raised 1.2 million reais, Brazilian reais, which is about 250,000 US dollars, and we are much grateful for that. Just 4 weeks ago, Our first package of health, educational, and food supplies reached the Amazonas just as the pandemic was peaking in the region. You can point to the next slide, please. Our training program got people engaged in combating misinformation and even got some youth back into employment, which was such a gift for us. We encourage families to share their soap and hand sanitizer home recipes within their communities, a strategy that worked for people to wash their hands more regularly. At last, the communities themselves proposed a photo and video contest to see who could make the most attractive and functional face masks, which has boosted knowledge about masks and has proven a strong weapon against disinformation. Our work continues to this day and has now reached almost 1,000 families in Amazonia alone. Coronavirus is not only fought in hospitals and research laboratories. Increasingly, we have seen that human behavior can make or break the resistance to the virus and can lower the curve, which keeps hospital beds free, keeps frontline staff at work, and crucially, keeps people alive. Pass on to the next slide, please. As I sat shivering in the remote bus station waiting for a 10-hour bus ride to the hospital many years ago, I had no idea how to recover, and help felt a long way away. Around the world as we speak, the same is being felt by marginalized communities, but much, much worse. Not only is COVID 19 far more deadly than dengue, it cannot simply be alleviated with specific tea leaves or specific painkillers. While we are proud of our efforts, the battle, of course, is not yet won. The fight against COVID 19 is a marathon, not a sprint, and we must be prepared for that. But in a world of big data, it can be easy to consider the most vulnerable groups just a statistic, and our project will prevent that. Thank you so much.
Thank you very much, Beatrice. We're often asked, what are we doing to reach the most vulnerable and those who are not digitally connected? And I think it's inspiring to see that the work that you're doing is filling that gap for sure. I'd like to now pass to our next youth representative, which is Lahiru Elvitigala. Lahiru is representing the COVID-19 Youth Survey. Lahiru, welcome, and you have the floor.
Thanks very much, Sarah. It is indeed a privilege and an honor to be here with all of you today, so thank you very much for this opportunity. My name is Lahiru Albitikala, and I am part of the Global Shapers community. But today I'm going to be talking about an initiative that we work together with 3 other youth organizations, namely the International Federation of Medical Students Association, the HeLa Alliance, and the More Viral Than the Virus movement. And this initiative is this COVID Youth Survey. I remember when COVID-19 first hit Denmark in late February 20, which is where I'm working right now. And I remember feeling a lot of confusion. I mean, what exactly is going on over here? Next slide, please, Kat, if you don't mind. Just as you can see with this person over here, I definitely wasn't as happy, but very much confused and uncertain about what's going to happen for the future. I have to work from home. I can't meet my friends and family. What's going to happen? And the more and more I talked about this with my friends and family, the more I realized that this is something that a lot of people are facing together. Everyone is facing these different emotions. And whilst all of us have gone through this pandemic together, our experiences differ greatly, so much amongst each other. Which led to the main question: how exactly are youth dealing with this pandemic? How are they dealing with COVID-19 information? What are their current concerns about this? So in order to tackle this issue, the 4 youth organizations got together to create this Google survey, a survey designed to find out what are youth's attitudes and perceptions towards COVID-19 information and the pandemic in general. So we translated the survey into 8 languages in total. And with our collective effort, we were successfully able to receive 2,666 responses from youth, which is 30 and below, from 130 countries. And today I'll be talking just a bit about the findings that we got. Thanks very much, Kat. So the first finding: which channels are youth using to refer to for COVID-19 information? Well, they're using WHO, so the website, social media, WHO social media rather, newspapers and electrical journals, and television news, as opposed to listening to information from celebrities and influencers and family and friends. So showing that they are looking to reputed sources of information. And the next one, please, as well. But all this information, as you can imagine, is having quite a bearing on all of us. Maybe some of you have heard of the term COVID fatigue. That is indeed what youth are feeling right now, where 51% said that they are tired and 42 people are feeling anxiety from listening to COVID-19 information. And the next one as well, thank you very much. And which leads to our final, one of the findings that we have, which is what are the current concerns that youth are feeling about COVID-19? And 60% said they are fearing about disruption of everyday life. 55% for mental health being a key finding from our survey, where below 30, they have found that mental health has really affected them compared to age groups above 30. And loss of job and financial security being another main concern. If you want to find out more about our results, please go to our website, covidyouthsurvey.com, where you can find out more information about this. And the last one, please, as well. So what are our next steps with regards to this? Well, we are hoping to create a report which we will share with WHO, with UNESCO, and also with international health authorities about our findings. But we have a lot more to do ourselves as youth organizations. As mentioned earlier, COVID-19 affects everyone. Of course, youth is a huge portion of that which has been affected, but all of us have been affected. And we keep on talking about seeing change or seeing the change that we would like to see. But really, if we want to see it, we need to create it ourselves. We need to step up and we need to make the change that we want to see. So to our first point, which Saad from IFMSA, Beatrice, who spoke earlier, and also Ian from Mobile and the Virus, what we would like to tell you is first, look after one another. Mental health is a serious issue that we have found out in our survey. And reach out to your family, not only your family, but also your friends. Ask them how they're doing. It could really make a difference in their day. And second, but most importantly, get involved. We need more people on the ground. We need to fight this together. And the four of us, all of the four organizations, and on behalf of all youth organizations who have been working on COVID-19 initiatives, we look forward to collaborating with you in the near future to eradicate COVID-19. Thank you very much, and over to you, Sarah.
Thank you very much, Lahiru. It really has been an honor working alongside you and the other youth representatives over the last couple of months and witnessing your professionalism and passion for your work. I'm now going to pass to Daniel Nwaezi, who is the Global Coordinator for the UNESCO-led Media and Information Literacy Alliance in the Africa Youth Movement. And Daniel, I believe, is in Nigeria at this moment. Daniel, over to you.
Yes, I'm in Nigeria. Thank you very much, Sarah Hess. I want to believe everyone can hear me, and I'm so happy to be here and to share some of the experiences we're doing from the global level down to the regional levels and to the local level. So I don't know, can you help me with the slides, please? So yes, the first slide. One of the things we discovered was that a lot of people did not trust. There were people building. They were losing trust in the government, and disinformation became a very, very key important figure during the pandemic because people were relying more on information that were not true, on informations that were completely false or not verified. So with support from UNESCO, yes, GAPMID is supported largely by UNESCO and it's led by UNESCO. We came up with multiple ways that we can help young people access this information. My colleague Beatrice has talked about the Hyla Alliance, where they worked with locals on the management forest and other issues. So one of the first things we did was to have talk about how young people can combat COVID-19. So we discussed issues from misinformation to disinformation. We discussed about mental health, we discussed about AI ethics, and discussed about learning and staying at home, parenting, and things like that. And then coming down to Nigeria, one of the issues that we raised was, what about if we highlight the impact that young people are doing at the local level? And that was right through the Nigerian messages. We talked about issues like the COVID positive stories. This was where young people were highlighting the impact and the effort that young people were making around COVID-19. Those that are working in the health sector, those who are working in the media and information literacy sector, those who are working in the education sector, and multiple issues like that. Please, the next slide. The next slide, please. So one of the things that we also did was that a lot of our ambassadors, we work with ambassadors from across 5 different regions that UNESCO works in, Middle East and North Africa, Asia Pacific, the Caribbean, North Africa, Europe, and North America. So one of our ambassadors, Mohamed Assad, is an innovation scientist and a third person. He worked with MFNet and they were able to develop a solution-based data collection in Jordan where they were able to trace contacts of people that were infected with COVID-19 and be able to reduce the impact of the community spread of COVID-19 in Jordan. And I also wanted to highlight the work of Poland Topman. Who works with the all European academies. And here they work a lot with issues around science, misinformation, and disinformation. And then Poland is also one of our regional coordinators in GAPMIL. So what they do is to work with young scientists, work with young educators, and see how to simplify information and see how to increase access to this information so as to reduce this information and to ensure that people have the direct access to the facts and the figures and information they need towards their health. So the next slide, please. So coming down, I also wanted to highlight the importance of the work that was inspired by GAPMIL, which is Least Liberia. Least Liberia was started by Mohammed Fobaris from Liberia. He's also one of our regional coordinators. So what Least Liberia did was that young people did not know where they could get access to information or where they could get training. So they built like a community center whereby young people can come at whatever time they want to have this kind of safe space and safe community to discuss about their health, to discuss about finding solutions to their health. Because one of the things also is that people are scared as to the stigmatization around, oh, am I infected with COVID-19? What would I do once I'm infected? So they built this community of young people in Liberia whereby it creates a safe space for them to share their ideas and share their implementations. And then downwards also to Jordan, Shirin Nani was inspired by the work that we do and also by attending the Global Media and Information Literacy Week, which Mr. Gilbega had mentioned in his earlier presentation. And this inspired her to start an MI initiative alongside the Global Shapers in Jordan. And what they do here is to work with young people, especially in refugee camps, who would naturally not have access to this information. Beatrice mentioned that they tried to go to the Amazonian forest, and also what Shirin tried to do was to engage young people in refugee camps who don't have access to these facilities, and to work with them over a period of 4 months, and ensure that they have the right skills and the right information that they need. And to round up, I also want to talk about one of the key campaigns that we're leading as GAPMIL Youth, which is called the MIL Clicks, and this helps to build creativity and to build intercultural citizenship, knowledge, and literacy amongst young people. As you can see on the screen in the next slide, it's a community of young people who are collectively sourcing information, collectively sharing this information, collectively holding themselves responsible, and collectively making information accessible to fellow young people like them. So we're global citizens. We work with a mandate to process MIL for all citizens. And as MIL Clickers, you have access to this platform of over 5,000 young people being managed by UNESCO to be able to share information, to be able to receive valid information from young people around the world. Below that, you can see the website where you can read more about MIL Clicks and where you can ask, where you can take the commitment to be an MIL Clicker and get access to relevant information and get access to the relevant tools and services that you need. So as young people in GAPMIL, we're trying to ensure that young people have access to the information that they need. And one of the things that drove me or that inspired me is that it's a popular African proverb that says, until the lion learns to talk, the story of the hunt will always verify the hunter. So young people need to learn to start being a voice for themselves, need to learn to start supporting themselves. And that was why that was the idea behind the community, to ensure that we have access to the right information. So that is my last slide. Thank you very much, Sarah.
Thank you so much, Daniel, for your presentation and also for the invitation for young people around the world to become milk clickers. I'm sure you will have many people signing up. We're going to stay on the continent of Africa now, and our next and unfortunately final speaker is Alawia Magali, who is a young reporter from RX Radio in Cape Town. Alawia is going to introduce herself very briefly, and then we have a recorded video statement. Welcome, Alawia.
Hi, thank you for introducing me. I don't think there's anything else I have to say. But as you guys know, I am Alawia Magali. I am from Cape Town and I'm a reporter at Oryx Radio. And I hope you enjoy the presentation. Thank you.
Thank you, Alawia. We will
My name is Alawia Magali. I'm a reporter at Oryx Radio, a radio station by and for children based at the Red Cross War Memorial Children's Hospital, Cape Town, South Africa. I'm one of 100 child and young reporters that have been trained at Oryx Radio since it started in 2016. At Oryx Radio, children are always behind the mic and are an active part of production. We design our own shows and host it as well. We choose our own music, write our own scripts, invite and interview guests, and even plan our own fundraising events. When coronavirus hit South Africa, we decided to record children's experiences of the pandemic and help them engage with adults, like parents, healthcare workers, professionals, policymakers, to show them that us as children have a key role in shaping the response to the coronavirus. This is when the children's voices on COVID-19 was born. Using WhatsApp voice notes, we have collected and shared experiences from children all over South Africa, and as well as collected voices from China, Argentina, and the United Kingdom. We gathered experiences from parents, healthcare workers, interviewed important guests, and created public announcements. A moment that really stood out for me during this pandemic, I wouldn't say it kind of stood out for me, but I'd say that's very interesting because one of my brothers has been tested positive. We would have never known that he had the coronavirus because there was no symptoms. And then after he had to actually self-isolate himself at home with us. So my auntie came over, which was a nurse, and she told us that we shouldn't treat him as a germ and just treat it as a flu, and that's what we did. And then afterwards, when he recovered after his self-isolation, all my aunties and uncles got the coronavirus for some reason, got tested positive because they've been showing signs and things like that. And I found it very interesting. As well as because like now we know that you don't know also if you have the coronavirus or not because my brother didn't show any symptoms. So I think that was very, very interesting because, you know, you can have it and not also show any symptoms. We'd also like to share experiences from other two young reporters at RX Radio, Kakamba Cuba and Usama Khan. Take a listen.
Hi, my name is Kakamba Cuba. I am 20 years old. My personal experience of COVID-19 has not been so great because I was forced to face the situation at home. I had to go home and I was scared to go home because of the situation at home. I stay in a shack house with 8 siblings and my aunt and a husband. We use public toilets and I was scared of contracting the virus since I have a chronic condition and I already depend on a ventilator machine. So I thought if I get the virus, it would be the end of me.
Hi, I'm Osama Khan. I'm 12 years old and I'm a RX Radio reporter. At the beginning of lockdown, it was interesting to see how everything changed. On level 4 restrictions, I could see my dad again. Now on level 3, I can travel with him to different townships to distribute food parcels, and I also have the opportunity to interview people of their experience during this pandemic.
These are only two experiences of children. If you want to find out more, then you can visit this website at www.rxradio.co.za/coronavirus. The response that we've got from this project has been incredible from other children, parents, and healthcare workers. We believe that it has given them a different perspective on the virus and it also given them an importance on listening to other children's voices. Thank you for listening to me and I hope that this helped you to understand more about us and understand the fact that it's actually extremely important to listen to other children's voices during this time. Thank you so much.
Thank you so much, Alawia, for sharing with us the incredibly important work that you're doing, chronicling the voices of children during the pandemic. Unfortunately, we've come to the end of the event. I hope that everybody returns to their day as inspired as I am. I think we have learned that there are significant challenges facing us all at this time, and that is something that we are sharing. And I hope that we can also share the hope and the passion that we have seen among young people today. We can achieve extraordinary things if we work together for good. Ensuring that as we sit here in our privileged positions, we do everything that we can to bring those who are less privileged than us alongside us. On this day, the theme of International Youth Day, Youth Engagement for Global Action, this is more pertinent now than ever before. And so I urge us all to ensure that young people have a voice and are engaged, as our Director General said, in the response and as we confront health problems now and in the future going forward. Nothing remains, therefore, but for me to say a very big thank you to all the speakers that we have had with us on the call today. Your energy and your enthusiasm is infectious, and I would like to issue a sincere congratulations for the work that you are doing. I would also like to say a thank you to our colleagues and friends at UNESCO with whom we have co-organized this event. We look forward to continuing to work with you. And so that draws us to a close, and I wish you all a good day. Thank you very much.